Hi, everyone. We're going to begin. My name is Ken Shaskis. I'm the Senior Program Officer here at the Foundation for Opioid Response Efforts. And I want to thank everyone for making it today to our opening webinar for an introduction to our foundation and the inaugural Access to Treatment RFP. We are at capacity for our webinar. We opened up 500 spots for it, and we filled up every spot as of yesterday. We did get some requests in this morning to join the webinar, but we will be making it available. We are recording it and we'll be making it available through a link on our website in the coming days. So if you have colleagues that weren't able to make it, we will make this available to them as well. So we just want to start off first with just with just an outline of the webinar. So we'll go over some logistics first of how people can be able to ask questions. Our president, Dr. Karen Scott, will be doing an introduction to our foundation. I will be going over the request for proposal that we released, going over a bunch of different things like eligibility guidelines, selection process. And then we're going to allot the majority of the time. We're going to try to cover all of that in 20 minutes, 25 minutes, and a lot more time to the question and answer session at the end of this. So first, just webinar logistics. We want to make sure that we get to as many questions as possible. So at the bottom, and it looks like somebody already submitted a question. At the bottom of the screen, you should see a Q&A button. Now, if you have a question, you can type in that question. You could send it using your name, or you can send it anonymously as well if you don't feel comfortable using your name. We ask that before you ask a question to go through the open questions that have already been asked. And if someone has asked that same question already, you can click the thumbs up button that's underneath it and upvote it. This will help us get to the questions that are most popular first, and also help us get through as many questions as possible. If we don't get to your question, don't worry. At the end of this, we're going to be compiling all the questions that come in, building out an FAQ, and we will also post that on the website as well. If our FAQ does not include your question, then please feel free to reach out to us. We should have contact guidelines on the last slide of the session, and you should be able to, we'll be able to answer your question. Great, and with that, I will turn it over to our president, Dr. Karen Scott.
Great, Ken, thank you so much, and thanks to all of you for joining us this afternoon. This is an exciting step for us in our progress of developing the foundation, and we're very heartened by the interest in our first request for proposals. I'm going to just walk through a little bit of, to give you a little bit of background on the foundation and our first few months, and how we've come to our initial area of focus. So the Foundation for Opioid Response Efforts is a new private national grant-making foundation founded last year and established as an independent 501c3, focused entirely on the public health issue of the opioid epidemic. The foundation was started with an initial endowment gift of $100 million from the McKesson Corporation, again with the sole goal of supporting solutions towards ending the opioid epidemic. We are established as a public charity, a private foundation, again as an independent organization, and along with our board, are charged with both developing our programmatic directions as well as our funding priorities and funding decisions. We're really pleased to have Dr. Andrea Barthwell as the chair of our board of directors. Dr. Barthwell may be known to some of you. She is a specialist in addiction medicine, past president of the American Society for Addiction Medicine, and has also had leadership roles in health policy, in drug and health policy. Along with Andrea, I've worked to assemble a leadership and staff with significant expertise and a real passion for thinking about innovation in healthcare delivery, innovation in public health, and approach this work with a very from a very evidence-based, data-driven approach to public health challenges. We've got expertise across our staff, trying to fix the volume. So, we've got expertise across our staff in biomedical research, public policy, healthcare delivery, public health, health philanthropy, and as well as specifically within the field of addiction. And we really think that this collaboration helps us think broadly about creative and new ways to contribute to addressing the opioid epidemic. This is a critical time, we think, for being to have the ability to bring some support some innovative work to bring this thinking to the field. Clearly, there's lots of funding, there's lots of activity, lots of attention being brought right now to the opioid epidemic, not the least of which is the leadership through public dollars, through federal agencies focused on the opioid epidemic. But we think how to harness all of that activity and attention, how to test new approaches and expand proven successful approaches to both prevention and treating the opioid use disorder is an opportunity in an area that the foundation can help contribute to. We really are going to be interested in a range of partnerships and collaborations, as well as grant funding support as we develop our work. And clearly today we're going to focus on phase one for us, which is the beginning of developing our grant making strategy. With that in mind, the foundation has set out a vision of this inspiring and accelerating action to end the opioid epidemic. And we will be focused on convening and supporting partners to advance patient-centered, evidence-based solutions to address the opioid epidemic. We want to maintain a focus on patients at the center of all of our work as we think about and explore the abilities for us to contribute and have an impact related to provider education, payment and delivery system strategies, policy initiatives, and public education and awareness. We're very committed to making sure that through our grant support, we fund a diversity of complementary projects that can really contribute to solutions to the opioid epidemic at national, state, and community levels. As you've seen in the RFP, we as a private foundation are considering grant requests from US-based public charities that are tax exempt under 501c3, or as well as from nonprofit tax exempt universities and state, local, and tribal government units or agencies for specific projects. We're looking for opportunities to broaden the activities to address the opioid crisis, to support innovative approaches, particularly for populations that perhaps have been less addressed or left out of a focus so far. We're going to stay focused on the patient and are interested in work that helps us think about how we move forward and improve care for patients with acute and chronic pain, as well as patients with an opioid use disorder or misuse of opioids. In terms of the kinds of projects we'll fund, we're going to be interested in seeing proposals and that help us, where we can help support new and innovative solutions and programs. But we're also going to be interested in where we can play a role in building on work that's currently going on that is proving to be successful, is proving to have an impact, how we can play a role there in scale and sustainability of those interventions. Our approach to developing our programs and grant making has very much started with listening and learning. We're a small staff here, we have a small board, and again, we know there's a lot of amazing work going on across the country to address the opioid epidemic. So we want to make sure that what we do adds to that and uses the dollars that are entrusted to us in the most impactful manner. So we have been convening program advisory meetings with leading experts to help advise us on where the work currently is, where there are opportunities, where the gaps are, and again, where a private, small national private foundation can make an impact in moving that work forward. That's one way that we're listening and learning. We really view the requests for proposals as another way for us to listen and learn and create opportunities to make sure that we're hearing from people and organizations across the country who we might not yet have had a chance to connect with, but have work to share with us and where we can engage in helping to think about what next steps might be and how we can help support work that, again, will have a meaningful impact. And to that end, I'm going to turn this back over to Ken to talk specifically about this request for proposals and what we're hoping to learn and accomplish.
Thank you, Karen. Great. So we wanted to start here with, how we came about developing this request for proposal. So, we were struck by many of the statistics that come out of the opioid crisis, but this number in particular, an estimated 2.1 million people in the United States currently have an opioid use disorder, but a fraction of them are receiving specialty treatment for their OUD. And so, we started to wonder, why is that the case? What are those barriers that there are to access this treatment? And this is data that comes straight from SAMHSA, the NSDUH survey. And this is a substance use disorder data. And the majority, this is data for people who perceive the need for treatment, but did not access it within the last year. You can see that the majority of people, the reason is not ready to stop using. But if we start to dig into the other reasons, we can start to see a pattern here. No health coverage or could not afford the cost. The stigmatizing that going to treatment may have on the person, whether it's a negative effect on their job or having neighbors have a negative opinion on them. But this was a sort of data that had us convene a program advisory meeting around these barriers to access to treatment. And we invited experts from a variety of organizations. Now, I want to stress that these were individual experts that came from these organizations, and we don't want to misconstrue that attendance by these individuals is an endorsement by that overall organization. But we wanted to convene experts that are on the front lines, on the ground, that really understand this issue. And what did we learn from this? Well, we asked them to highlight these barriers to specifically evidence-based care for OUD, so medication-assisted treatment with behavioral wraparound services around it. And the ideas that were highlighted again was the social and cultural stigmas of addiction. We saw financial constraints, health insurance coverage issues, a lack of wraparound social services necessary for continued care after a patient goes through treatment. And then on top of that, there's plenty of regulatory and legal limitations. Data quality is not high for addiction treatment services. And then we hear a lot, again, on the other side of the health insurance, employers are not really understanding the importance of these addiction treatment options when they provide these healthcare plans to their employees. So what else did we learn in this advisory meeting? Well, it was highlighted that, we acknowledge that this public health crisis, it does cut across all demographics, geographies in this country. However, we do recognize, and it was recognized in that meeting, that there are certain populations that are underserved and vulnerable, less likely to be connected to medication-assisted treatment, that have higher mortality rates, and it is a higher burden on those populations. So these are some of the examples that we saw, disparity between rural and urban settings, looking at the issue of race when it comes along with this, men versus women, and then on top of that, the criminal justice system, where it's disproportionately affected by it. As you can see, the 4 individuals involved in that system are over 40 times more likely to die from an opioid overdose within 2 weeks post-release. So that, we took all this information and then it informed us to release this proposal a request for proposal of improving access to opioid use disorder treatment and recovery services for underserved populations and communities. And the main purpose of this RFP, which I have highlighted here, is really to help providers and communities develop ways to treat the most vulnerable and underserved populations with opioid use disorder by creating and evaluating a number of innovative programs or policy proposals, models, systems that improve access to a continuum of care of appropriate addiction treatment. And we put appropriate there for a reason, including the wraparound and recovery supportive services, or that expand upon existing models. We do see that if there are existing models out there, we don't want to reinvent the wheel here. If there's an existing promising model out there that we can fund and bring to a national level, we are interested in seeing. So within our funding opportunity, what are the target populations? We spoke about those underserved populations. And this is a list of examples of underserved populations. It's not limited to this list, but this is what came out of our program advisory meeting of the populations that should be highlighted. So again, rural communities, children and adolescents. We're particularly interested in pregnant and issues around pregnant and parenting women, justice-involved individuals, the LGBT community, and definitely Native American and tribal communities as well. Now, if you have identified another vulnerable or high-risk population that you want to submit a proposal for, we are open to that as well. So what are the kinds of programs and services that we're interested in looking at? And important for us, we are really interested in improving and reforming the continuum of care, providing those wraparound social services, and addressing all the areas that are necessary to facilitate high-quality, patient-centered treatment to improve outcomes. And I stress patient-centered as that is a crux of our program here. Everything that we fund needs to have the patient at the center of it. And these are examples, these are very broad examples of such projects that we would be interested in. So, programs that treat the whole patient. And I'm sure that these are phrases and concepts that many of you are familiar with. Treating the whole patient, offering medication-assisted treatment within the gaps of the healthcare settings, meeting patients where they are, a no wrong door policy to connect patients with appropriate treatment services, working with the criminal justice system to bring more of this evidence-based treatment and behavioral health services to patients. And then on top of that, looking at the new policy and education initiatives around health insurance and payer strategies that could then help inform state and local policymakers to increase access to treatment. So what are the target projects that we're looking at? Again, although we're based in New York, we are a national foundation, and we're very committed to funding a diverse cohort of projects across the entire United States, particularly in areas that are very, very hard hit. Now, I can't stress this enough, because if there's one bullet that I think you can take home and think about when you're developing your proposals is really that we are looking for innovative and creative ways to remove barriers to opioid use disorder treatment and recovery services. And then on top of that, your proposals should be able to credibly demonstrate that the potential to be scaled to a national level, as we are a national foundation. And our goal is to reach the largest number of patients and have the greatest impact possible with our funding dollars. And on top of that, of course, for any project to go well, the applicant must be able to show as well a commitment from their organizational leadership that they have the support behind it. Now, the award amount and length, which we've gotten some questions about. So right now, our starting point is applicants may request up to $300,000 annually for up to 2 years. So that's a maximum of $600,000 for the total term of the grant. Now, I want to stress, though, that the award amounts and the duration has to align with the scope of work and the capabilities of the applying organization. So with that being said, projects can be proposed for less than $300,000 annually and for less than 2 years, and depending on the project, that's may be what is required. So I would make sure, and we do require a brief budget form in our LOI, and I would think about how you budget your project out. Now, eligibility is a question that we've been getting a lot of questions about. So we sent out on the original RFP documents, we sent out another clarification about which organizations are eligible for this. And this is the most up-to-date that we have. So US-based 501c3 public charities and organizations are always eligible to apply for a FORE grant. Nonprofit institutions of higher education as well, the same thing. We also would like to fund projects from state governments, local governments, city governments, and Native American tribal governments as well for specific charitable purposes, meaning that we wouldn't be given a block amount of money for general purposes for the department. The money has to be allocated in the proposal. The budget justification needs to explain what that money is going to be used for. So just going over key dates. So we released our RFP on July 17th. Today, we're having our open webinar, and a little over 3 weeks from now, the letter of intent will be due. We understand August 25th is a Sunday. We thought we would give you the weekends if you to have a little bit more time to submit the application. Yeah, and then at that point, and then we're expecting in mid to late September to notify organizations that we are interested in seeing a full proposal, and we'll see probably at the middle of January, we'll be able to give notification of final decisions. So just going over the application requirements. So we are putting in a grants management system, but for now what we want is all of our applications to be submitted by email to accessrfp@forefdn.org by 11:59 p.m. on August 25th, 2019. The guidelines, so on our website, when you download the RFP, it should be a zip file containing 3 different documents, which should be the actual RFP document, the brief budget form, which should be a very, very, very high level overview of your proposed budget, as well as the letter of intent instructions. I would focus a lot on the letter of intent instructions because the formatting and component requirements that are in there will be strictly enforced by the review team. We can see that from the overwhelming response that we've gotten to the webinar that we expect a lot of letter of intents coming in. So we want to make sure that everything is coming in the format and requirements that we are requiring. So anything that submits will unfortunately not be able to be considered during the application review process if it doesn't meet it. Now, we want to be transparent about our selection process and how it will move in the months coming forward. So the first step is to submit a letter of intent to FORE through that email that we described. FORE then will evaluate all the letter of intents for responsiveness to RFP, does it match up to our goals of the foundation, and then seek independent expert review as needed. We will then select projects to be invited to submit a full proposal. And from that point, that organization will have 5 weeks from that notification to submit the complete full proposal. Those proposals then will be reviewed by a panel of external independent experts. And there'll be experts where we'll pull experts from is a variety of different sources. So we'll have experts that are physicians, staff leading opioid-related work in federal or state government agencies, academic researchers in addiction medicine, substance use, pain management, behavioral health, academic researchers in delivery systems, sustainability science, public health and health policy expertise, as well as experts in human and social services, experience in providing wraparound services as part of a continuum of care. So we are going to, we will have a wide range of experts looking at these proposals. And during this time, depending on the feedback we get from our panels, we may actually come back to certain organizations with feedback on their draft proposals and potential recommended revisions that can help build a stronger proposal. At that point, we'll compile all those scores and funding recommendations will be prepared by the FORE program staff and presented to our board of directors for final approval. At that point, all approved proposals will then be subject to a grant award agreement between the foundation and the grantee organization. I just wanted to put up some contact information now. So any general, and these are actually included also in the RFP itself, but any general and eligibility inquiries, please email info@forefdn.org. Any programmatic questions, and this is not just for the RFP, but if there's any sort of programmatic questions just going forward, feel free to email me, Ken Choskis, and any technical questions related to the RFP or anything going forward, you can email our program assistant, Lydia. All right, and that's all we have. So we can actually now start on our Q&A session.
So the first, sure. So the first question is how many grants will be awarded, and is it possible for an organization to apply for more than one grant with different target audiences in different states and regions? So we have not put a hard limit on how many grants we will do in this round. But we are anticipating it most likely will be in the range of 10 to 20 awards. Again, we're going to be open to having some flexibility around that based on what we receive in terms of LOIs and proposals. And as Ken described, depending on what we get and how long it takes some proposals to be developed and to be fully developed, we may ask for some proposals to get on a faster track and with a bit more accelerated schedule, and others ask for some additional time to fully have them prepared. But you can. We're working again with a range of probably up to 20 projects is what we would aim to do in our first round.
So the next question, yes, the next question, is there a limitation to the use of funds, for example, indirect costs or recovery support services? Yeah, so indirect costs, we have some guidance on indirect costs for the budget on the brief budget form. The foundation will cover 10% of, our indirect cost rate is 10% of personnel and direct costs. And in terms of the limitation of the use of funds, there's no limitations as long as in the letter, in the proposal itself, that the money is allocated for a specific purpose for the project. You know, we won't accept giving a block fund that can be just used for a general purpose without it actually being defined in the proposal itself. So the next question. So the RFP refers to funding projects that are removing barriers and improving access to MAT, but the LOI seems to be focused more on education and policies. Does this grant cover treatment? The answer is yes, it does. There we go. So it does cover treatment. You know, so the thing that we wanted to do was outline our focus areas. And yes, certain priority focus areas are going to fall much more in line with this RFP. However, if you have a project in a priority focus area that you believe fits into it, you know, we would definitely consider it. But I would not, I wouldn't necessarily move, I wouldn't necessarily, I guess, pigeonhole yourself into a certain focus area. You know, I would try to, if something you believe fits into increasing access, whether that is provider education or a policy proposal, you know, we would be interested in seeing that.
Yeah. One thing I'll add in terms of treatment coverage, what we won't be able to do with our grant funds is support an activity or something where there should appropriately be other funding available. So, for example, if the question is specifically around covering treatment for a particular patient, we would be expecting that you to be looking for obviously using insurance, Medicaid, et cetera, block grants, other funds to pay for actual treatment wherever those are available.
And that's an important point. You know, we are looking to fill as a foundation a gap in the funding environment. So, you know, in areas that are very well funded already, that money is available, public money is available. You know, that may not be as great of a fit for a project for us. So a few questions. To what extent are you interested in a proposal with a scientific design, such as comparison groups versus an evaluation? Related to that, are you open to proposals that involve formative work, or are you looking for proposals that involve rolling out a program right away? We are interested in all of the above. All of the above. We expect projects are going to come in at different levels, levels of development. So I would, you know, not preclude anything that you believe is a quality project. Next one. So the RFP states that, quote, the applicants must demonstrate a commitment to and support for the proposed project from the organizational leadership. With a 3-page LOI limit and no mention of a letter of commitment in the RFP, how do you recommend demonstrate our organization's commitment to this project? So there is one section in the LOI that talks about your organizational structure. I would put in a very brief line there that you do have the support. When we move to, if we decide to move to full proposal stage, that is the point where we will require letters of support, formal letters of support from your leadership, as well as any collaborating institutions. So for the LOI itself, though, it can be very brief.
Priority area 4 states that raising public awareness about effective opioid use disorder treatment and recovery services is a priority. Would community education about opioid use prevention, how to use naloxone, how to access local recovery services fall under this priority? So broadly, in terms of the priority area overall for the foundation, I would say yes, but specifically, the focus of this RFP it is focused on access to treatment. So this would not be a response that focused on the community education prevention. Naloxone would not be a fit for this specific RFP, but we would ask you to be staying tuned and stay connected with us. We will be continuing to, again, get expert advice and to inform our future RFPs that would relate to that priority.
Mm-hmm. So would training pharmacists be to better counsel patients about opioid misuse and also about treatment and recovery services fall under the priority areas of provider education and public awareness? I believe that it could. You know, I think that it depends, I guess, on how you're framing your project.
Again, I think be mindful that the focus for this particular RFP is going to be on the connecting people with treatment and recovery services. Again, we will be coming back to some of the more upstream prevention activities and education later in the fall.
Right. So the RFP seems to be focused on clinical projects, but the LOI lists provider education as area of priority number 1. So would a project focused entirely on provider education be eligible for funding consideration?
Right. Again, if it's provider education in the context of making the link there for us between the role of that education and improving or improving access to treatment, then that would be would be responsive.
And I wouldn't necessarily rank provider education as area of priority number 1. It's more just all those areas of priority are important to us.
Right. We're not. We don't need to put one on top of the other.
Exactly.
Or,
you please define payer and provider strategies, what meeting that priority would look like or consist of?
Sure. So we are certainly hearing a lot and are interested in some of the delivery system models for improving access, for removing barriers to care. Some of those models include the work that's happening that's focused on the emergency departments in terms of initiating buprenorphine and then connecting people with bridge clinics or ongoing sites for their ongoing treatment. Hub and spoke model, where again we're reorganizing the delivery system to provide both the specialty care and access to ongoing treatment through ongoing MAT through primary care settings. So those are examples of a couple of the types of provider strategies, delivery system models that we're seeing. Along with that, understanding how you pay for that would be, would contribute to us being able to have a better understanding of how to sustain those models.
Can a 501c3 that has not yet received the IRS determination letter submit a letter of intent? So we will be performing for an LOI, yes, but at the full proposal stage, we'll be performing due diligence on all organizations. So by that point, you would require that IRS determination letter. Is there a specific patient impact target number, minimum range? No, as of now, that it's a very hard number to put on right now. So there's no specific patient impact target number. The only guidance we give is that even if it's a pilot study, that the measurements and outcomes that come out of that and are built into the study can show that it could demonstrate that it could potentially be scaled at some point. Is the award a cost reimbursement contract?
Maybe we should follow up with that.
We should follow up on
question
that
afterwards.
question. Yeah.
I think we're not quite clear on what you're asking.
Yeah.
These are grant awards, and our grant letters will define with the grantee a set of deliverables. Will tie payments, grant payments to a set of deliverables, milestones over the course of the grant period.
Can we submit more than LOI per organization? As we answered, yes, definitely. As long as the projects are unique to each other and are not overlapped. We don't want duplicates coming from a single organization, but as long as the projects are different, yes, an organization can submit more than one letter of intent.
300,000 total amount for each year, yes.
Yes.
Directs plus
yeah,
and
it
indirect.
includes both directs and indirects.
Mm-hmm.
Can you talk about how the areas of priority in the LOI, provider education, payer, provider strategies, policy initiatives, public awareness, connect with the examples of projects that are in the RFP? Does a project expanding use of telehealth in rural settings increase MAT fall under payer and provider strategies? Yes, it does. So we would say anything that's telehealth, that is bringing a new provider strategy and a payer model potentially. So I would definitely put that into that category. Can you expand more upon what types of policy
initiatives? Again, under policies, we could envision work that would contribute information and help inform ways of expanding and sustaining models of delivering care or models of addressing specific barriers to care that can then be disseminated both at a state level as well as informing policy nationally. So it may be analytic work, it may be data analysis, it may be other types of projects where we're getting key informant interviews, really assessing the opportunity, where the gaps are in current policy and identifying potential options for addressing those. Yes, the Q&A questions will be posted on the website.
We're going to build an FAQ with the top questions, and we'll post it along with this the recorded webinar, and this Q&A session is going to be recorded as well. It will be posted on the website. Hopefully, it will be up by Monday. Can this funding be used to support primary care provider time and expert-led ongoing clinical support?
if the time, in the context of a specific project,
Yes.
to expand access to treatment services, yes.
Would EHR interface modules specific to project goals be an allowable expense in the other direct costs category? And are DEA license fees under the MAT waiver an allowable expense?
EHR models. I would say that the EHR modules would probably fit within the direct costs, and we should just confirm on the DEA license. So let us follow up with you on that one.
And when we move to, if we move to a full proposal and we break down the budget further, you'll find like, you know, EHR interface modules may fall under a different category. We're gonna definitely get more into the nitty-gritty of the budget. Yes, the answers will be posted. Would property insurance be considered an allowable expense? No, unfortunately, it will not be allowed. Are nonprofit, can the
Yes.
funding be used for direct patient care? Yes.
Again, on only if
Specific.
there's not another source of funding for it, and we would be expecting that. Again, we can't use the grant funding to duplicate or replicate what should be funded through other sources,
And it would have
particularly
to be,
through Medicaid and other insurance.
and it would have to be outlined in the proposal exactly where that money is going to and for what purposes.
Right. Nonprofit hospitals are eligible for grants. Yes. What are the criteria for the grant review? Great question. Ken mentioned we're recruiting, and we'll have a panel of reviewers, and we'll standardize a review process with all of our reviewers. But to give you a sense of at the proposal, so firstly at the letter of intent stage, where we are anticipating that review to be a pretty high level one. We're going to look for basic responsiveness to the RFP. Is it a project about access to treatment? Is it within the, is it within the parameters in terms of budget, time frame? Does it seem to align and legitimately be something that could be done within what's proposed? When we get to full proposal stage, we will be asking our reviewers to do quite substantive reviews. We're going to ask our reviewers to comment and assess proposals in terms of the significance of the proposed project, impact of the project potentially on patient populations and on the field and the epidemic overall. We're going to ask them to comment on the availability of any existing data or evidence to support the effectiveness of the proposed project. Innovation will be a key area of interest for us. We're going to particularly want to prioritize projects that are bringing something new and really promising to the field, rather than purely replicating something that's been done in another location, or purely looking to extend something that's currently being done. We're going to be looking for what applicants are proposing in terms of being able to assess the effectiveness and outcomes of their projects, what the expected outcomes are, and are these reasonable to expect from the particular project. So measurement strategy, and as well as strategies and likelihood of a project being able to be sustained, being able to be spread, what a communication strategy around the project might be as well. Hope that gives you some, so again, we're continuing to flesh out that list, but that gives you some idea.
And once we get, if you are invited to the full proposal stage,
Right,
we will provide some guidance on what the review criteria will be to help guide your writing of the full proposal. Can you describe the length, sections, and format of the full proposal? At this time, you can kind of think of it as the letter of intent, but much longer. The questions in it are going to be similar. We're going to be asking for much more detail, a lot more preliminary data, a lot more detail on your process and measurable outcomes. It's going to be around 7 to 8 pages that we're going to ask. So we're increasing the detail of it. And then the big difference is the budget, where while in the LOI, we're asking for a very, very high level brief budget. We are going to be asking for a line item budget with every personnel name on there, with every item, you know, and a budget justification for why funding is needed for every one of those line items.
And again, more details will come out if you're asked to submit a full proposal. Is there interest in joint proposals between medical centers and community agencies? Absolutely.
Yes,
Those sound like exciting models. Can funding be used to bridge the costs for medication-assisted treatment until medical benefits can be secured? That's a challenging one. So the question is, can funding be used to bridge costs for medication-assisted treatment until medical insurance benefits are secured? I think we would be open to looking at that with you, and having some more conversation.
Will harm reduction efforts, including syringe access services and linkage to wraparound care, be considered?
So if the question is in the context of connecting people with access to treatment, we could consider projects along those lines.
What would be the reporting requirements? So the reporting requirements is going to be specific to each project, so that's a hard question to answer. But we will require reports on a regular basis. Explaining reaching certain milestones in your project, the final report as well, and a final outcome report. But that right now is going to be very dependent on the project, so hard to give a general answer on.
Can you expand on what activities you won't fund because you would expect others to be funding them? So here we're particularly thinking about, again, recognizing there's a lot of federal funding that's also supporting, that's very focused on the opioid epidemic right now as well. So one example that comes to mind is there's a lot of funding that comes through SAMHSA to support provider training related to the waiver. That therefore doesn't seem like the best place for us to put our funds unless there's a good case to be made for a really clear gap in terms of where the public dollars are not going. But beyond that, I think it'd be for the person asking the question, if you've got a very specific question around an example, then you're not sure, we're happy to talk to you offline about that.
This grant be used for direct services or pay for clinician salaries?
Again, pay for clinician salaries in the context of a project to improve access, to reduce barriers and improve access to treatment and related services.
And we would cover the percentage of that salaries depending on the time effort
for
that they use on that project. Will projects that address more than one priority areas be more favorably reviewed? I
would say we're really looking at, I would say the kinds of questions that that in terms of how we're going to ask our reviewers to evaluate the proposals is really going to be very broadly in terms of feasibility of the project, the potential impact from the project, the ability, potential for it to have a project to have lessons learned or scalability or some way of having an impact beyond an immediate location. It's likely that projects that do all those things will have components to them that relate to provider education and policy, and as well as delivery models. But I would think about it more from that perspective than just starting out by trying to check each priority.
And I would keep in mind the award limitations. We will provide up to $300,000 annually for 2 years. So, when you are developing your proposals, definitely keep that in mind to make sure, a more focused project, may be a better use of those funds.
Can funding be used to support recovery services? Yes.
Yes.
Will review or critiques be available for all applications, whether awarded or not? We are going to make an effort to provide summaries of proposal
For the full
for
proposal
full
stage.
proposals.
But we won't be
able to do
it for LOIs just because we expect an overwhelming response.
So we cannot do capital support. We can support a specific projects. I'm sorry, I should read the question.
Yeah.
We're in the midst of a capital campaign for a new residential program for pregnant and parenting women and their children. Sounds like a really exciting program. Can we request capital support and our startup operational support? We can't do capital support. But again, if you can shape some aspect of the work that you're getting started, that would fit into a project or have more of a programmatic focus or help address some aspect of your program. Certainly the overall topic is one that would be of interest to us, but we can't do capital support. It's a challenge of private foundations.
Yeah.
Would a proposal focused on health professions, education, and MAT be competitive, given that's a long-term strategy for expanding access for your pipeline, right? Or are you more focused on immediate impact versus education of licensed providers? So I should say that another area that we are very interested in is health professions education. So we would welcome seeing proposals along those lines. We have convened a separate advisory group to advise us on medical and clinical education and training, it may well be that we issue a subsequent RFP to go further into the health professions education area, but we'd be interested in seeing proposals on that.
So another question we have here is, will you accept an LOI about a prison program that is being piloted, given the notoriously slow movement of proposals within prison systems, with support but not necessarily without specific concurrence in the proposal? Yes, we definitely would. Another one, would youth prevention services in schools be a good fit for this RFP? Again, prevention services as an overall foundation goal, is of interest. However, for this RFP, it's not necessarily does not necessarily fit in the scope of it. So, but stay tuned in the future and definitely stay in contact with us.
So, question about an organization in Chapter 11 reorganization being eligible for the grant. That does not sound like an area that we can support. So, question about how we're defining rural. Our hospital is in an urban area, but we serve a mostly rural area. Our suicide rates are higher than our state rate, but just 11% of the need is met in our area. Yes, the focus is on the population that you're serving and the area that you're trying to reach in terms of the project and reducing barriers to care. So it doesn't necessarily mean that the organization itself has to be located there. Expand on the definition of wraparound services, please. Sure. So from our advisory meetings, we're hearing a lot about the need to be thinking about both how wraparound services help contribute to reducing barriers and keeping people connected to care. So those services may reflect some of the social determinants that can help make it difficult for people to connect and stay in care. So being able to connect through perhaps community organizations to ensure people have transportation, to perhaps having community health workers involved in their care, or peer support programs that can provide more ongoing support than the purely clinical visit.
will demonstration of matching grants help win an award?
Not necessarily. Again,
yeah.
it really depends on the scope and having a budget that aligns with what's being proposed. Certainly, if what's being proposed is a significantly larger project than the budget that we're providing through this RFP, then being able to say that you have secured or additional funding obviously strengthens the project. Yes.
So the question is, are you defining rural using the HRSA definition? And that, yes, we are doing that. So the question, is there a specific list of evidence-based practices or criteria for determining if something is evidence-based that we should consider? So when we say evidence-based practices, we are referring to medication-assisted treatment, wraparound behavioral services, things that have support in the literature and from the community as an evidence-based practice. So when formulating your proposal, we do ask a lot for preliminary data for publications. So I would make sure that you have a lot to back up what you're proposing.
2 minutes. Would you support an MAT training program for nurse practitioners? So we would be interested in looking at it again, at making the case for, if it's a project that can help make the case for reaching a particularly vulnerable or underserved population, and making the connection to access to treatment through that sort of route. We would be open to, we would see that fitting within the proposal.
Will there be additional funding rounds in the future? What will the focus be? Yes, there definitely will be more funding rounds in the future. We do plan to, we plan to fund, through a couple different mechanisms. RFPs will be released periodically. I would look towards our focus areas as kind of a guide to where the future RFPs will be. So things around medical education, things around prevention. So definitely stay tuned. Pain management. So definitely stay tuned.
We have time for maybe one more question.
Yeah. So we can go.
Sure. In terms of scaling a local project to the national level, would FORE consider project manual, publication, project team disseminating at conferences as appropriate strategies in the 24-month period? Sure, and we'll be interested in your thoughts about what the best ways are to reach the audiences for the work that you're doing. And those are certainly some good examples within the grant period. But we also fully understand that and recognize that dissemination, communicating the work and the outcomes of a project can go beyond the actual grant period.
Yeah. And with that, we've reached 3 o'clock. We somehow have managed to get through 57 questions. We're really happy we're able to do that. We thank everyone for coming today. Again, we've recorded the webinar and the question and answer session. We will be putting it online on our website. It's available to everybody. So if you have colleagues that are looking to get some more information about the foundation and the RFP, please direct them to our website.
And if you've got a question that we didn't get to, please email us at info@forefdn.org. We're happy to continue the conversation and make sure people get the information that's helpful to them.
Thank you, everybody. And
Thank
we
you
look
so
forward
much
to receiving your applications.
Yes, thanks for your time.